Hello, I'm Adriana Albini and I am the principal investigator of the study on the systemic distribution of single-wall carbon nanotubes in novel models. This is a collaboration of several institutions, the IRCS Multimedica Milan, University of Insubria Varese, Regina Elena Cancer Institute and University of Genova, and several authors. The first author is Elisa Principi.
Single-wall carbon nanotubes are extensively employed in industrial settings due to their unique physical and chemical properties. However, we know very little about the potential risk and toxicity for public health. Until recently, there were no precautions regarding the use of these novel materials. Here, we investigated the effect of single-wall carbon nanotube administration at systemic and local tissue level. We examined metabolic, water-food consumption dejection, functional serum enzymes, and morphological organ and tissues alteration in CD1 mice treated with single-wall carbon nanotubes, using metabolic studies, serum analysis, histological, immunohistochemical, and ultrastructural transmission electron microscopy methods.
Single-wall carbon nanotubes resulted in an overall bone marrow cell proliferation and increased TNF-alpha serum levels. At local level, we found that the nanotube exposure resulted in increased serum enzyme levels linked to liver damage. The single-wall carbon nanotube administration resulted in a liver inflammatory state with abundant leukocyte infiltration. They were mostly macrophages with an M1 polarization state. We conclude that single-wall carbon nanotubes administered to models induce several acute proliferative cell response and a systemical increase of TNF-alpha levels. Functional and biochemical alterations induced by the nanotubes suggested that the liver represents a main affected organ, as confirmed by the presence of particle aggregates. This is the most novel finding of our study. Macrophage activation in the liver tissue following the nanotube administration were observed. Studies in the literature, along with our new results showing long-term nanoparticle accumulation in the liver, indicate that caution should be paid in exposure and use of single-wall carbon nanotubes in the environment and for medical settings.